Hello, my name is Trinity McFadden. The title of my research presentation is Elucidating BIPOC, Black, Indigenous, People of Color, Students' Perspective on Navigating the COVID-19 Pandemic. My research mentor is Dr. Joseph Hill. This study was done with the NTID Research Center for Culture and Language. Health literacy is very important, especially in a global pandemic. Health literacy means the ability to find, understand, and use health information to make health-related decisions for themselves and others. When I started my research, I noticed a few things. First, I noticed that there wasn't a lot of research done on the BIPOC deaf community. Second, I learned about the mistrust in both the BIPOC and deaf community for both health-related research and in the medical field because of historical and current aspects. The last thing I noticed was that traditional methods of research are not the best approach when doing research in either of these groups. Linguistic barriers can become misinformation and misunderstanding. Do you remember learning words like quarantine, social distancing, other words like that? Learning these words can be challenging for some, especially in the deaf and BIPOC communities respectively. This was a challenge because English was more likely to be a second language and it's hard to understand new health-related terms. But we can improve these information gaps. We just have to make sure that the information is available, accessible, acceptable, and adaptable. As of right now, multilingual communication efforts are not adequate. The COVID-19 pandemic has shown disparities in health in other areas. For example, in the deaf and hard of hearing community, previous research has shown that deaf individuals may have lower levels of health literacy. They also may experience communication barriers every day with mass media or social situations. During the pandemic, these situations have not improved. As a result, a lot of information regarding COVID-19 has not been accessible for the deaf community. For the BIPOC community, they've experienced higher numbers of COVID cases and related deaths. They also had barriers with accessibility, but it's a little different compared to the deaf community. Their experience included not being able to access testing locations, it was harder to access personal doctors, and there was a shortage of hospital beds. Living and employment environments for BIPOC individuals also weren't the best. Some couldn't work from home, or maybe they had a lot of family members, and the list went on. These factors made them higher risk for contracting COVID-19. These are my research questions. What is the COVID test and vaccination rate of BIPOC RIT students? What are BIPOC students feeling about COVID-19 testing and vaccination? What are the challenges BIPOC RIT students face during COVID-19? This is an ongoing survey, and before the symposium started, there was a total of 23 students who participated. About half of the participants were deaf or hard of hearing, and the majority were BIPOC students. All of the participants were balanced, and I'm focusing on BIPOC deaf and hard of hearing as well as BIPOC hearing. The testing and vaccination rates were really similar. Their feelings about receiving and testing vaccinations were lower than the rate, but still similar. All of the BIPOC students from the survey were included in these charts. About 60 to 67% were fully supportive of both testing and vaccinations. However, about 40% seemed to have some doubts. In a broad sense, many BIPOC students mentioned that they felt isolated, some lost some income, and some were bullied or harassed during COVID-19. When it came to communication about the pandemic, students said that the information was hard to understand, wasn't in their language, and difficult to access. In summary, all BIPOC students from the survey received testing, and a large majority did get vaccinated. However, this is a limitation to the study, as RIT has required testing and vaccination for COVID-19. As a result, I plan to interview more students so we can go in depth and provide more information from a student perspective about COVID-19. Maybe I can expand this project to Gallaudet University to research more BIPOC deaf students. Here are my references. I would like to thank everyone who helped at the Center for Culture and Language. Your support was really appreciated, and I had a wonderful time this summer working with you all. I would also like to thank the McNair and LSAMP programs for providing this research opportunity. And last but not least, thank you for watching my presentation.